My name is Schmidt. I'm a general and visceral surgeon specialized on the cancer treatment, mainly of the liver and the pancreas. I arrived in Switzerland in the year 2011. Meanwhile, my professional experience is almost 30 years. So many people don't know what visceral surgery actually means. Essentially, it means that the surgical treatment of the internal organs, starting from the esophagus to the stomach, the liver, the pancreas, small bowel, colon, and rectum. That's the main focus of visceral surgeons. Well, I started my career in 1991 in the University of Heidelberg, and I had the chance to accompany two main surgical directors over 10 years each. And I really learned a lot from them, not only in terms of surgical tips and tricks and techniques, but also in terms of how to deal with patients, how to explain patients' difficult situations. But if you think of the patient relationship between a surgeon and the patient, one might think it's not very important because the patient is sleeping anyway during the operation, but that's not true. The opposite is true. And it is the art of the surgeon to gain the trust of the patients in the first or at least in the second conversation they have, to explain them what kind of operation they need, why they need this operation. You also have to tell them the risks and possible complications. And if you do this in a very sensitive way, you will see that you will manage them in a much better way because the patient and the doctor are pulling in the same direction. Well, if you ask me what is the most important aspect of a complex cancer patient treatment, I would answer that the principle of hope is probably one of the most important issues that has to be addressed. And in most cancer patients that are selected for operation, we have a good chance for cure. But of course, there are complex cancer cases, for example, multiple metastases, and the chance of cure becomes lower in these cases, but it is not zero. But even in those cases, I think you have to fight for the 10% or for the 20% chance. And if it happens to be true, you are happy. But if it happens not to be true, at least you have tried. Medicine is always international because a patient in Nepal looks exactly the same from the inside than in Germany or Switzerland. So that is a clear advantage. We can work everywhere. And I enjoy going to other countries, also to poor countries like Egypt and Georgia, for example, where I'm frequently operating poor people. I saw many hospitals, very poor hospitals, very sophisticated hospitals. And from that, I learned that with a suture and a needle holder and the forceps, you can do many good things without high tech. That's the fascinating aspect of surgery. One of my prime interests, apart from medicine and surgery, is nature. I love nature. I love birds in special. So since I was a young boy, I was running around with binoculars and watching birds. And I preserved part of this. Of course, I have not so much time, but if I have time, I go and enjoy nature. My advice to my young self would be, don't do much different, because I've enjoyed every year in my life, and if I look back, I wouldn't do many things different. I was lucky to choose the right field and to study medicine. I was very lucky with my family and my wife. The only downside is hospital and medicine is very time consuming. It takes you away from your family a lot, and you and your family have to know this. But if you accept this, if they accept it, it's wonderful to work in medicine and in surgery.